Hello and welcome to an interesting session on infertility. Today we have Dr. Renu Sehgal with us. She is the Chief Obstetrics and Gynecology in Artemis Hospital and Daffodils Hospital. So we will be asking her a few questions and we will try to debunk a few myths with respect to infertility. Infertility is a common problem in India, both in urban and in rural settlement, and as much as 15% of our couples have this issue. So let's start with our questions. So ma'am, what is infertility?
When a couple who is been having intercourse, unprotected intercourse without using any contraception and a timed intercourse for regularly for 1 year is not able to conceive, that is when we label it as infertility.
Okay, so ma'am, what according to you are the most common causes of infertility in India, in what you see in your general setup?
See, in India, we also have, India has also undergone a rapid change in, with urbanization, with now late marriages coming in, and people are now more career oriented. We are having late, they decide late to have children. So, late age of marriage, late age of having children is one of the causes. Second, most important is the hormonal imbalances that have come because of the changes in the lifestyle that we all have. The most common being polycystic ovarian syndrome, thyroid disorders, diabetes, which is on rise. India is known as the diabetic capital of India. These all can cause infertility. In fact, diabetes can cause infertility related to men also. It affects the sperm count and the quality of the sperm. And in India, also we have some sexually transmitted infections, some diseases which can lead to, infection of the uterus and the fallopian tubes, and they can cause infertility as well. And in India, we have tuberculosis on top of that list because tuberculosis is quite endemic in India, and we still get infertility related to tuberculosis in India. Though in Western countries, they would have more other STIs, but in India, we have more infertility due to tuberculosis and chlamydia. Also, one more thing that I would like to add is there are certain things in our environment that can cause infertility, and these are mostly the pesticides. The plastic usage has increased which has led to infertility. Adulterations in the food that can cause infertility, and other chemicals that are usually present in the environment. All of them can cause. Smoking and substance abuse can cause infertility too.
Okay, so ma'am, how will a couple know that they are infertile?
Infertility as such, it's not essential that you will have any signs and symptoms of infertility. You can have you may be infertile and you may not know about it. It has nothing to do with your ability to have intercourse or a proper intercourse. You can have infertility. You will know that you have infertility if you're trying to have children and you are not able to conceive, and you will have to go to a doctor for them to conduct some tests to be able to know what is the cause of that.
And ma'am, in your opinion, how does age impact the fertility of a lady?
We have, everybody knows that after 35 years of age, the fertility of women do decrease. There is a definite decrease in the antral follicle count or the ovarian reserve of the women. Apart from that, also there are some changes at the oocyte level and the spermatogenesis level in males also after 35-40 years of age, and the quality of the egg and the quality of the sperm also decreases. So age does definitely affect the fertility. And nowadays, because of environmental factors and because of these high smoking and alcohol intake and sedentary lifestyle, we are also seeing a lot of increase in a premature ovarian failure, where even a lady who is at 30 years of age can behave like, and ovaries can behave like those of 45 years of age.
Okay. One more thing, ma'am. How common is infertility in India and the world at large?
It is actually very ironic that we being the almost the highest populous country in the planet, but still the infertility is on rise, and worldwide we now know that the prevalence rates are anywhere around 10 to 15%, and same is the case with India. And in fact it has nothing to do with urban and rural. Even the rural population, we are witnessing the same rise in the infertility cases.
So ma'am, what are the signs and symptoms of infertility, and when should the couple come to you for advice?
There are no particular signs or symptoms we can look for, like I said, but if a couple is having difficulty in having intercourse, if the lady is having irregular or delayed cycles, if they are having heavy menstruation, there can be fibroids there, so they should go to a doctor. If there is any abnormal discharge which is refusing to go from treatments, these may be subtle signs, but there are no particular signs, and a couple may be infertile even without any signs and symptoms.
So how do you diagnose infertility? How do you guide the patients, ma'am?
So the first thing that we have to ensure is that they know what a fertile period is. Because of our lifestyle changes, because of sleep disturbances, because of the work schedules, most of the couples don't have a regular timed intercourse. They don't time their intercourse at the time of ovulation. So whatever you do, it is not the frequency of intercourse that will matter. It will matter that if you are having an intercourse at a particular time, and it is the ovulation time. So first thing that we guide them about is the fertile period. And of course, the minimum basic test that we do is a thyroid function test. We do the ultrasound of the female. We do a semen analysis of the husband, and we test the fallopian tubes if they are opened by a thing called hysterosalpingogram, and we also do few hormonal tests. We may do an anti-Mullerian hormone to see how good is the ovarian reserve, and so on and so forth. We also test for diabetes, very very important, and then if we find any abnormalities, then accordingly we can do further testing.
Okay. So, how do we treat infertility, ma'am, and when do we advise the couple to go for IVF?
So there's one more myth regarding to infertility, is that infertility is only treated by IVF. No, it is not that. There are many factors, like I said, a simple thyroid dysfunction can lead to infertility, and if you correct it by hormones, couple can conceive on their own. The same goes with diabetes. If you can correct the diabetes, couple may conceive on their own. Polycystic ovarian disease, for example, may need some hormonal medications. It may need some ovulation induction drugs, and couple may be able to conceive on their own. It is only when we have documented ovulation, we have monitored the patient for over 6 months, and despite having regular ovulation cycles, despite having open tubes, they are not able to still get pregnant. That is when we advise them to go for IVF, or we may advise a couple to go for IVF straight away if we feel that the anti-Mullerian hormone is very less. That means the ovarian reserve is very less, or the semen count is very less, and that means the couple may not be able to conceive on their own.
So ma'am, we have spoken about the treatment. Now, what can we do to prevent infertility?
Yes. First of all, I think the first thing that we have to decide is, and we have to counsel the couple. Stress is a big factor for infertility, and we know that if the couple is stressed, then the infertility, the hormones still go for a toss. So psychological counseling is first and foremost. Then second comes changes in the lifestyle, changes in your diet. You have to get into a healthy diet schedule for yourself. You have to lose weight. You have to come to a normal BMI almost.
I'll just take 1 minute to ask you, what do you exactly mean by healthy diet schedule? What should the patient eat? What should they avoid?
Smoking, alcohol, alcohol maybe in moderation, but smoking is a big no-no if you are trying to conceive and if you are infertile. Eating habits, I think mostly we should avoid packaged processed food. That is the one thing that has been known to cause infertility the most. And any high calorie food and added sugars.
Okay.
That is what I would want everybody to, avoid, and go on more green leafy vegetables, more fresh fruit, and all the protein rich, that is the normal protein, the healthy protein in rather than going for processed food and looking for.
So basically, we should go for more home food,
freshly cooked food rather than having getting a takeaway, going for a takeaway.
Yeah.
Should avoid pizzas and burgers, and
most of the tasty things are not so healthy.
Not so healthy. Yeah.
Okay. And ma'am, why do we need to talk about infertility? Why is talking about infertility important? Not only with respect to the family pressures, but also with respect to a woman's self-respect and her confidence. Like when she goes to a society, when she, is in a social circle, having infertility may be considered as a stigma sometimes.
Yeah, Nidhi, you have hit the nail on the head. There is a huge stigma associated with infertility, and unfortunately, we often stigmatize the women. Because women are, thought that they should be bearing the children, they should be rearing the children, and if a couple is infertile, then the cross is on their head. We have to first debunk this myth that infertility is because of women. Men and women have been equally known to be the cause of infertility. Equally important. To label the uterus as a cause of infertility is totally misogynist, I feel. And secondly is that we have to talk to people. People have to know that if the paper, even in the family, it is a big taboo subject to talk about. It goes from the childhood. If we don't give a good sexual education, if we are not open about talking about menstrual issues, sexual issues, or intimate issues in the family or in the society, then it becomes a taboo subject to talk about. Third thing is that, the couple who is undergoing an infertility treatment is already under a lot of stress, both financially as well as psychologically, and then the society kind of labels them that they don't have children, or now they're going from IVF. There is again a big myth that in IVF the child born is not yours, and that myth has to be totally debunked, that the IVF child is absolutely the couple's own child.
The stress then adds on.
It adds on to the process, and and there may be some families may even go to the extent of labeling the females as unwanted or banned, or we shall get a new bahu to get the hair of or the heir of their family, but whereas the problem may be lying with the son. Yes. We have seen so many times
not
this.
Only in the rural places, in the urban places.
It's very, very common.
Yeah. So, how old is too old to have a baby?
Well, actually, nowadays we don't talk about that. We say that you are not too old to have a baby. But yes, on a serious note, 35 is what we call the age is kind of a barrier, and 35 to 40 is a gray zone, but 35 is definitely when you should definitely think about having children. Don't go beyond 35, because your fertility will definitely decrease after that. This goes for both males and females. Males, please don't think that you are like you can have children forever.
Yeah, that is very correct. So, ma'am, what are the myths commonly associated with infertility in our society?
Same, like I think I've discussed that infertility is because of the women problem, because women have problems. Another myth is that the IVF child is not the couple's own child. Another myth is that in IVF they somehow they manipulate the genes, which is not there. And one more myth is that if if we are able to have a sexual intercourse at a proper place, then or properly, then we can't be infertile. Men usually think that if they are able to have intercourse, they cannot be infertile. These are some of the myths, and yes, also one big myth, like all infertile couples need IVF. No, they don't.
And ma'am, is it also true that all the IVF babies have to be delivered by cesarean?
No, of course not. Once the pregnancy is conceived, every pregnancy is treated the same way. An IVF pregnancy, also the obstetric indications remain the same for them, like for the normal pregnant who has conceived by a non-IVF thing. At the end, I'll just like to say that what is the need of the hour is that, of course, social education, community participation is must, but also public health and community health has to be emphasized on, and there is a huge need to reduce the costs associated with infertility and IVF to make it more affordable and more accessible.
Yes, definitely. So ma'am has addressed very important issues concerning infertility, and I hope this session helps you. Thank you.
Thank you.